Thank you. Question to you, also. I don't know if you were listening to the previous presentation, but Dr. Yoon showed NCCN guidelines where we have a mutation and then the list of drugs. And for some mutation, the number of drugs that's listed there is like 6, 7, 9. How do you decide which of the targeted drugs to use in the situation where more than one has an FDA approval?
Yeah, I think you made the comment earlier that the NCCN guidelines are confusing, which in this case is definitely true. So I think there are a few answers to that. The first is that as you get familiarity with these drugs and these trials, you have your preferences about when you use certain ones. And I think that that's been formalized in some ways in pathways within institutions. So some institutions have very formal pathways about their preferences. Others are a little bit more, they're not as formal. It's more of a group consensus. We generally start with this in this situation or this one in this situation, and we kind of all agree. I do think and I think people are going to talk about it in some of the next sessions. It's actually getting more confusing, and there are probably more opinions about which drug to start with. But one of the ways that we have tried to formalize it is that when we have an alert system for when we detect something that's targetable, and we put down the pen preferred options. It's often not just one. It might be one or two or three, but it kind of gives a consensus to the rest of our health system providers about kind of what the group thinks about what to do next.